Hello, and welcome to VOW, Voices of Wisdom, the show that might not be for everybody, but everybody needs to watch this show. Do you snore loudly or heavily while you sleep? Are you excessively sleepy, or do you have energy? You don't have enough energy by the end of the day. Do you fall asleep while you're driving? I hope not. Do you have nightmares at night or night terrors? Or have you experienced recent weight gain or high blood pressure? Have you been told you hold your breath at night when you sleep? If you have said yes to any of these questions, you might be suffering from something called sleep disorder called sleep apnea. And today we have Anna Marie Wellins here that's going to help us talk about this. How you doing, Anna?
I'm doing very well, thank you, Brenda.
Good. So how you been?
Very good, very good.
You know, this topic's a very, very serious topic, and we talked about this, and we said that we felt it was very important to really get this on the air and talk about this. So tell us a little bit about your background first, and then we're going to get into talk about this disorder.
Well, I'm an adult nurse practitioner. I work in Sag Harbor for Meeting House Lane PC, which is affiliated with Southampton Hospital. And I'm also a doctoral student at Stony Brook. I'm finishing my first year out of 2 in the DNP program. So I'll have a doctorate in nursing practice May 2014.
Now, what is the DNP program for some of us that don't know what that means?
It's for nurse practitioners that continue to a doctoral level, and it involves research and also in terms of being able to be qualified to go into teaching and mentoring other nurse practitioners. So it's really a research-oriented degree, and it's basically population-based care.
Oh, okay.
So, and the population that I'm interested is in adults with obstructive sleep apnea, because it's a underdiagnosed, undertreated disorder that many adults, men and women, more men, but still it affects many people, and they're not aware that they have it, and it has significant consequences if it's not treated, if it's not diagnosed and treated. The estimates, 4% for middle-aged men and 2% for middle-aged women, but those estimates are probably low.
Really?
It probably affects between one out of 5 middle-aged adults. And again, men tend to have a higher incidence for a couple of various reasons.
Is there something that causes it, or is it just something you're born with, or?
Part of obstructive sleep apnea, it's one of a number of sleep disorders. The issue with obstructive sleep apnea is that when we're awake, we have muscle tone that keeps our airway open. So, we can breathe freely through our nose and mouth, and the air gets to our lungs because of this muscle tone. When you're sleeping, particularly if you're sleeping on your back, this is the time that the body tries to repair itself. Blood pressure wants to decrease, heart rate wants to decrease. It's the time that the whole body it's restorative, that you need to repair the tissues and the cells.
Right.
So muscle tone relaxes. So when you're in a supine position, and depending on how your airway is, because we all have slightly different airways, that those muscles will relax, and the tongue tends to fall to the back of the throat, and therefore you have this obstruction. And what happens is the body tries very, very hard to breathe against this obstruction until the body just tires out, and then the breathing stops. And individuals with this condition can have hundreds of these episodes every night. They may not even remember it. And because
you said hundreds?
Hundreds, yes.
Wow.
And
where they actually
stop breathing. So that usually you'll hear snoring. It's very typical. And then what happens, because when you're snoring, the air is passing through a smaller space, so it's a vibration that's
So
occurring.
that's what actually what that snoring sounds.
Right. It's a vibration through a narrowing space or a narrowing airway. So that's what the snoring is. And then eventually, because the body has to work so hard to breathe against that closed space, there's periods of time when the breathing stops for 10 seconds or more, and that's called an apnea, or without breath. And what happens is if you keep having these episodes, your oxygen in your blood drops down. It puts a lot of stress on the blood vessels and the cardiovascular system. And they call it this oxidative stress. And it contributes, or it's a factor that contributes to hardening of the arteries,
Really?
cardiovascular disease. It can cause or worsen high blood pressure. It makes diabetes worse. You can have heart arrhythmias and therefore have a lethal heart arrhythmia and actually have a death-producing arrhythmia during sleep.
Wow.
So it is very, very serious, and it's important that it be recognized, not only for the cardiovascular issues with it, but what happens is when you have these constant awakenings that because you stop breathing, the oxygen goes lower in the bloodstream, you awaken, but you don't remember it, but you never get to deeper sleep. There's something called rapid eye movement sleep, and that takes a good 20 minutes into the sleep, or more, 40 minutes into the sleep. So if you keep waking up, even though you don't remember waking up, you never get to that deep sleep.
Right.
And what happens is during the day you feel really lousy. You have a headache in the morning, you are very tired during the day, you feel extremely fatigued, you can't concentrate, you're irritable, you get depressed.
Right.
You have trouble concentrating at work. You sit down in front of a TV or in front of your computer at work, you're dozing off, hopefully not dozing off while driving, but driving is a really big issue. And you have individuals that drive for a living, like long-distance truck drivers, if you think about it.
That's right.
And also, people are more prone to be depressed. So there's something, it's called neurocognitive impairment. It's all of those, the ability to function during the day, and a sense of well-being is affected. And then also, when you feel this way, you don't have energy to exercise, you grab, comfort foods, which is your high carbohydrate, high fat foods. It's all that cycle, and then the weight. And also, when you don't get that restorative sleep, there are hormones in the body that are appetite suppressants and stimulants.
Really?
And then what happens is that when you don't get the sleep, your appetite is stimulated because you have an imbalance of hormones. So there's a tendency to gain weight. And then the more weight you gain, the more tired you are, the worse the sleep apnea is. Obesity is an independent risk factor for obstructive sleep apnea, but people who are not overweight can have sleep apnea because they can have just the way their airway is configured can cause the apnea itself. But weight makes it worse because particularly when you're on your back and you have a lot of weight in particularly your midsection, it pushes down on the diaphragm. And also it just pushes down on the neck area, and it just makes it worse that the individual has to overcome even more obstruction because the weight is also compounding.
I don't want to make light of this, but I just have to, because I'm who I am, I have to say this. I remember a friend of mine came over, and he had to stay over because he had to go to classes or whatever he had to do. And he was overweight, and he snored. And I swear I thought the walls were going to come down. It was so intense till, it almost frightened me. Besides me, I didn't get any sleep.
Right.
But later on, I had somebody else who was overweight, and they were sitting in front of me, and I was talking to them, and they would just fall asleep, And so I just automatically thought it was the weight. But now that you explain that, it makes so much sense. It's a combination of.
Certainly the obesity doesn't make it worsens it. And a lot of times the bed partner is the one that prompts the individual to go get help. And because they have to flee the bedroom because they can't
flee the house.
Flee the house. Exactly. So they're usually the ones that prompt the person. And they have to get a sleep study because it really has to be diagnosed. Because there's other sleep disorders that, you know, could fall into place. So they need to have that sleep study.
And you showed me earlier some sort of...
Yeah, this is just basically screening that's done in primary care. It's called a stop bang, and it basically, it's a tool to assess if somebody's at risk for sleep apnea. And the S is for snoring, so it's somebody that's snoring at night. Tired during the day is the T. The O is the individual's been observed to stop breathing during sleep, have these pauses. And then the B, here the pressure for P, high blood pressure, they're usually at higher risk. BMI, which is body mass index, if someone is overweight or obese, they're more at risk. Age, over 50. Neck circumference, usually it's 16 in a woman and 17 inches of the neck circumference in a man, again because of that weight. And then gender being male are somewhat, they're at higher risk. So if you answer yes to 3 or more of these, you are at high risk for having sleep apnea. And obviously, you know, you need to be evaluated by your primary care provider, and who can make an assessment and then therefore refer you to a sleep study.
And you know, for someone who's watching this and they might have answered yes to any of those questions I said or this, just give us a little bit of detail of the process. I know a little bit about it, but give us a detail about the process of getting the testing to find out whether, you know.
Your primary care provider, who could be a physician, nurse practitioner, can order a sleep study. And basically, you have an in-lab sleep study is when you go to a center, and they wire you up. You're like wired like an astronaut. And the usual thing is, you know, you have electrodes in your head for the EEG. You have electrodes over your eyes, around you have wires around you have hooked up to a cardiogram, and you have wires around your chest, and how can I sleep? Well, you really do sleep. You don't have to sleep the whole night. You just need some time of sleep for the monitoring to assess and to verify that you are having these apneas. They could tell by the EEG and how your breathing pattern is.
So they generally, just like I said, it's usually an overnight.
It's usually an overnight study. Sometimes the first night of the study, if they can see clearly that you have sleep apnea, then the second half of the study, they can start you on the CPAP, which is the continuous positive airway pressure device, and that's the treatment.
Right.
So after the sleep study, then you have to have a specialist has to read the sleep study. There's also sleep studies that can be done at home.
Okay.
They're not as they don't have the amount of monitoring that an in-lab sleep study. Anybody that has high blood pressure or they have a lot of other medical problems usually needs an in-lab study, because the home study is not as comprehensive and may not pick up other important aspects that the physician or the sleep specialist would have to look at. So the sleep specialist, who's usually board certified in sleep medicine, will read the sleep study and then make the determination about if the person has obstructive sleep apnea and how severe. Is it mild, moderate, or severe? And moderate to severe sleep apnea or mild sleep apnea with symptoms of daytime sleepiness and symptoms of sleep deprivation usually need positive airway pressure for sleep at night, and that's the treatment. So it's like any chronic disease. If you're a diabetic and you need to take insulin, or you're an asthmatic and you need to use inhalers, obstructive sleep apnea is a chronic disease, and it's treated with positive airway pressure breathing. And that's wearing a mask or some sort of oral facial device hooked up to a hose and a machine. And the technology has gotten so much better. The machines are smaller and quieter, and there's no flashing lights on it. And it's just a matter of finding the right interface with the machine, the mask, whether it's over the nose or over the nose and mask, or for some individuals, something called a nasal pillow, which goes right underneath the nose itself, can be used.
So what is that machine? I mean, are they...
It's just pressurized air. It's not oxygen.
Air.
Right.
See, I always thought it was some other oxygen.
No, there's no oxygen in it. It's just pressurized air, and what it does is, again, when you're sleeping, you're obviously laying down, and some people have more of an issue when they're on their back. So a lot of times there's certain devices you can use, pillows, to get you on your side, because people do better. Many people do better when they have sleep apnea when they sleep on their side. So something as simple as sewing a tennis ball in a T-shirt and wearing it backwards.
Really?
Because when you lay on that tennis ball, you're back on your side. I mean, or there's different pillows and different devices you can use. So you have to wear this device. You have to get used to wearing the device, and it's important that you have the right education and the right support to get you acclimated, because it's not something that you can just do 1, 2, 3. It's a very overwhelming. You know, you look like an astronaut going into outer space at night with a mask, and even though they have come a long way with making the devices so much more user-friendly, it still takes a lot to get used to. And unfortunately, there's a very high rate of individuals starting with CPAP or positive airway pressure, and they abandon therapy because it's, you know, too difficult, it's uncomfortable, they're claustrophobic, or there's a lot of leakage through the mask, and then they just give up. And that's where, you know, it's very important that individuals that start out using CPAP make sure that they get those problems resolved so that they can be successful in their treatment, because one night of not using your CPAP, you're just going back to square one, you know, with all of the cardiovascular damage, with the inadequate sleep that you're getting during the night, and the sequelae, the chronic, you know, problems that will occur, the worsening of, you know, of their cardiovascular disease, a much higher risk of getting a heart attack or a stroke. 10 years earlier, if you have untreated obstructive sleep apnea, you're at a higher risk for a heart attack and stroke 10 years earlier than your counterparts that don't have obstructive sleep apnea. Wow. So it's really, really significant.
That's serious. It's
very serious.
Very, very, very serious. So you're answering another question for me as well. So you're saying that doing the CPAP can cure?
Yes, that's the treatment. Well, it's not like you're going to do, it's not a cure in the sense that, you know, use it for a month and then you won't have sleep apnea anymore. But it's the treatment. Just like a diabetic has to take insulin, the insulin is just replacing what their body is missing. Their insulin is not being produced in the body, so that they need to have injections. Right. Or it's like an asthmatic or someone who has emphysema using inhalers. It's part of the treatment. It doesn't get rid of the disease or the condition. But if you have obstructive sleep apnea and you know, if you can lose weight, if weight can be you can improve it. It doesn't always get rid of it completely. In some individuals it has, but you can certainly make it better and improve it. So it's not as, you know, as severe as you can make it from severe to moderate or mild sleep apnea, which you may not need to have the CPAP then. And that would be determined with another sleep study down the road. Because it's not something that you could just say, I lost 20 pounds, therefore I don't need my CPAP anymore. You have to make sure that you are under the care of a physician and also a sleep specialist.
But it is possible, though, with that combination of using the CPAP on a regular and maybe you're losing the weight and et cetera. Is it possible?
It's possible.
To at least get off the CPAP?
Well, not.
No?
There is a small percentage of the patients, yes, that it will, but it's not always the case. You know, it's considered it's a chronic disease, and it requires long-term treatment, and this is the treatment. And what happens is when patients feel so miserable, they're so tired during the day, and they start using the CPAP, they feel better because they got this restful, restorative sleep, and they want to use it because, oh my gosh, I'm feeling so much better. I don't want to be falling asleep at the wheel. I don't want to be falling asleep I don't want to be depressed and irritable, and I want to be able to focus and concentrate at work. So, and then they have more energy. So they want to feel that way, because when you've been feeling lousy and then all of a sudden you feel great, you're like, okay, whatever's making me feel great, I'm going to keep doing. And if CPAP, you know, is the answer, but the issue is getting over that hump with the CPAP in the first couple of weeks, because you may not have that instant, like, I'm feeling better. Some people do. Some people, like, the next day, they feel better. Other people, it may take a while to feel better. So it's important that they stick with it and they get the support and help that they need to be successful.
Okay, I'm all about prevention, Anna Marie. So is there anything that anybody can do? I guess I'm almost probably answering my own question right now. I guess once you have it, how would you know you're going to have it?
Right. Well, with the epidemic of obesity, there's definitely more obstructive sleep apnea. But some individuals, not every heavy or overweight or obese patient has sleep apnea.
Right, right.
And there are many very thin individuals that don't have a weight problem have it. If you have enlarged tonsils, like tonsils are like kissing each other, you know, then the tonsils have to come out. If you have an obstruction in the nose, like polyps, and you have corrective surgeries to correct the obstruction, then that can remedy. Like children can have obstructive sleep apnea because their tonsils and adenoids need to they need to be removed. So in adults, yes, that can be the case as well. But again, keeping weight is very important, and also exercise, a good diet, high plant-based diet, low fat. And again, refined carbohydrates are all very, very important, and just general health.
Yeah.
And all of those things, helps cardiovascular health, and also it will help your general health in terms of, maybe not developing, maybe just having mild obstructive sleep apnea, which may not require CPAP.
Right. Like I said, I've experienced and seen someone deal with this, and I know how serious it is. How can we get more of this information out? I know you're doing it now, and we're going to do it as we're doing it now on this show. But how else can we?
Well, I think that the people need to know, if they are, or their bed partners, are they snoring? Are they observing them to stop, that they stop breathing? Those are really two big indicators right there. And again, all of the things with the stop bang that I reviewed in terms of the snoring, the tiredness, the observed breathing cessation, high blood pressure, the obesity, age over 50, large neck, and gender being male, although women, have it as well. Then they need to talk to their primary care practitioner and maybe say, I think I'm tired during the day, I have a headache, I can't concentrate, I don't feel good, I'm gaining weight, I'm trying to lose weight, but I can't, and so have a sleep study and then go from there. So the public needs to be educated.
Right.
Also, the primary care practitioners need to be educated to look for these signs and to do some screening. And the stop bang takes all of 2 minutes, if that, to go through this. It's a very, very quick, screen to do on patients where you may suspect that they have more of an issue.
What is the cost factor in this? I'm just thinking of people who might not can afford. Because that usually comes down to...
That's always an issue.
Yeah.
The sleep studies are covered. If somebody does have health insurance, they are covered. A lot of the health plans now are pushing more for the home sleep studies, which are better than, but in some patients it's not appropriate, the home sleep studies. And they're a little bit more difficult because they get sent the equipment in the mail, and they have to figure out how to put everything on. So there's some issues with that. But insurance companies do cover the sleep studies. If an individual doesn't have insurance, it's a really big issue because it's expensive. An in-lab sleep study is expensive. You have a technician who's there the whole night with you. You're usually in a hospital or in a center, hooked up to very expensive monitoring equipment. So yes, it is expensive. It's important, and it's only it's not like you need one of these sleep studies every 6 months. But and then the CPAP machine itself is expensive, and insurance companies do provide coverage for it. Medicare will only provide the CPAP machine if you're compliant using it, or you demonstrate adherence, that you use it at least 4 hours a night, 70% of the nights. If you don't, because the CPAP machine has a smart card in it.
Oh, really?
Like that information gets downloaded. So you
Wow.
can actually see
Wow.
if the individual is being adherent and they're using it. It's not like you can just turn it on and the card will be activated. You have to actually wear it, and the pressure has to get activated. And Medicare will take the machine back if you're not using it because it's expensive. I have some patients that have sleep apnea that can't afford, that had the sleep study but then lost their insurance because people are on insurance, they lose their insurance, they have to wait to get back onto insurance, and hopefully when the Affordable Care Act comes in, there's the exchanges that people can maybe get that more coverage or better coverage or get some coverage. You know, it'll be a little bit better, but you know, it's a few $1,500, $2,000 for a machine. So there are some companies that have refurbished machines that you can buy. They're maybe not the latest and greatest, you know, newest model, but it'll be a refurbished machine for a lesser cost. So that's an option as well. And they can contact the local home care center and ask if they have a refurbished machine if they can't afford it. And you know, so it is definitely, we know it works, the CPAP, but there are it's a complex treatment.
And not only is it complex treatment, but honestly, my concern is that people who really need it can't afford to even use it or get
absolutely.
the treatment.
And you know what?
That's
just
a concern.
The population that are underserved, in normal care for blood pressure, diabetes, for asthma, all the chronic diseases are underserved in this regard as well. There's no question that there's definitely, you know, a big gap in the care of those patients.
You have a doctor that you want to refer? We have like 30 seconds
Yes,
left.
I have.
I just want to make sure.
There's a board-certified sleep specialist. He's board-certified in sleep medicine. He's an ears, nose, and throat doctor. He's in Port Jefferson. His name is Dr. Lee Shangold, and his number is 631-928-0188. And he, you know, he's a physician that can, you know, he can order the sleep study, or he'll at least be able to, if you go and get evaluated by him, he will be able to direct you in the right place.
So we know that this is a very, very serious disease, and thank you so much for all this information, and I hope people who watch this really get help.
All right, thank you for having me.
Thank you. Have a good day.